Hello, everyone, and Happy New Year. Welcome to McGill Cares webcast series supporting family and informal caregivers. I'm Claire Webster, a former caregiver, certified dementia care consultant, and founder of McGill University's Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee the program, who include Dr. José Moret from the Division of Geriatric Medicine and Dr. Serge Gauthier, Professor Emeritus, formerly of the McGill University Research Center for Studies in Aging. These webcasts are made possible thanks to the generosity of donors, and I would like to sincerely thank the Zeller Family Foundation for sponsoring today's webcast. Well, January is Alzheimer's Awareness Month, and I'm extremely pleased to have some of my colleagues and a very important non-for-profit organization from Montreal, the Alzheimer Society, here with me today on McGill Cares in order to discuss how the Alzheimer Society of Montreal supports persons living with dementia and care partners. So my guests today are Jeane, who is the Executive Director, and Christine Le Bourdais, the Director of Programs and Services. Welcome to McGill Cares.
Thank you.
Thank you.
So I think we'd like to begin by, first of all, sharing with our viewers what is the Alzheimer Society of Montreal and your programs, and tell us about your mission.
Thank you very much, Claire, for having us today with that webinar, and Happy New Year, everybody. So our mission at the Alzheimer Society of Montreal is to alleviate the social and personal consequences of Alzheimer's disease and related disorder through the development of and delivery of leading-edge intervention, care, and support services in Montreal. The Montreal Alzheimer Society has been created in 1981 when the Alzheimer Society of Montreal was founded by mainly caregivers. So I think in their historical, they found that there was some lack of communication tools and support for caregivers. So they created the Alzheimer Society of Montreal.
So what are some of the specific programs that are offered in Montreal? And not only the programs, but how can people access these important programs?
Thank you for asking, Claire. We have a lot of programs. We have programs for people living with dementia. We have programs for caregivers, and we also have programs for both of them. So for the program for people living with dementia, we have the support group for caregivers and for people living with dementia also. We got the individual consultation for people who just receive a diagnostic or people living with disease also. We have the support groups, the weekly ones and the monthly ones. We have the heart therapy group. We have the laughter yoga. We have the creative dance with the Les Grands Ballets de Montréal. And we have also a partnership with the McGill University with the program What's Connect Us. And to be able to participate in those programs, you just have to contact the Alzheimer Society of Montreal. You can go by calling us or going on our website. And if you go on our website, you can also see all the programs and all the schedule of every program and be able to connect with us. And we will be more than happy to contact you and get you in board in a group.
Are there any fees to participate in these programs?
Some are light fees and some are free. So it's different depending on the programs.
Okay. And so I just want to take a pause and talk a little bit about the impact of COVID, like what you've seen in terms of how COVID has impacted some of your clientele. And then also, how did COVID impact the Alzheimer's Society of Montreal? I know that a lot of organizations like yours were not able to offer in-person activities. So what impact did COVID have?
I would say that it impacted all of our services, but all of them have been adapted to reaching out to our clients in various ways. And one of the impact that we see now that our services are mostly back in person or getting back in person is the impact of the social isolation on the development of the neurocognitive disorder, which we know is a big factor of protection. So that's what I would would say. But all of our services have been adapted. People are really good at adapting also online, which at first it can be hard, learning new ways to connect with each other. But most of them, they did it well.
Mm-hmm. Well, we were very happy. The McGill Dementia Education Program has done a pilot project with Alzheimer Society of Montreal and started a program called the Sharing Room, which has been a virtual support for spouses and children who are caring for a loved one. And we saw the power of virtual support in our particular program that we're doing together. Have you seen, like, has it been easy for people to access, like doing Zooms with you or a support group via online?
Well, for some of them, it was really a challenge. It's a new way of connecting, as I said. And some of our clientele didn't have iPads or laptops, or even some of them don't have internet services. So there are challenges, but there are also community services that help people get in touch with each other, help them to connect. And we also always keep some time, when we start a program, to make sure everybody can access to Zoom. We just don't send a link. We make sure that they're able to connect and everything. But it can be quite challenging, and it can also impact other caregivers, especially because now they need not only to care for the person they help, but also support in technical ways. So it's another task for them in some cases.
So the Alzheimer Society of Montreal is part of a large national organization. Can you perhaps just explain a little bit about, how does it work within the umbrella of Alzheimer Society of Canada, and do other provinces offer similar programs as yours?
Yes, of course. We're all linked to the Canadian Alzheimer Society, and depending where you live and where you are and the context of the environment where you live, programs can change because we adapt the program depending on our capacity and depending on the needs in the society. In Quebec, we have now the Fédération des Sociétés Alzheimer du Québec, and they represent 20 Alzheimer Society all across Quebec. So we have different programs in each society, but some of are also the same. Most of them, they do have trainings for medical professional, and they also do have in-home respite and stimulation. So these are the programs that probably we all share together. In Montreal, we have different programs. We have one that is really oriented in prevention. We have the Ma Santé Cognitive, cognitive health program. This is a new program that we did build in-house and that we're promoting to the grand public, but also people living with the disease and their caregiver. So this is a particular program, and we're really proud of it. So any other program, Marie-Christine, that you're thinking about?
No, I really think that, the Alzheimer Society in different regions, they adapt to their different clientele. In Montreal, we don't have the same challenges, I would say. We have a lot of different cultural communities. We have also different languages that are being spoken. So the basics of the programs, I think, are the same in the goals that we have, but the way that we deliver services can be quite different. But we can imagine that every person in Quebec can have services from their Alzheimer's societies in their regions.
And there's a great collaboration between all the society also. Yeah. We all have the same goals to support the people. Yeah.
So how does the Alzheimer Society of Montreal help people live well with dementia?
In various ways, I would say, but the basics of our programs and services is really the person-centered approach to care. So once we have this in our mind, we always address the needs of the person and really try to identify how to better respond to them. So it's by having adapted services to the person's need. It's different ways of support, different ways of giving information, giving trainings. So it's on various levels also. It's individuals, people that have a diagnosis of dementia. It's also by helping their care partners, but it's also about bringing awareness in the community. So there are various levels in which we can help people live well with neurocognitive disorders, but always based on person-centered approach to care.
Mhm.
Okay, so let's like take me through the steps. So let's say, like, I'd like to know what tools and services are there to help a person who just receives a diagnosis and their care partner. Like, is it at what point should we reach out to the Alzheimer Society? Is it once we receive a diagnosis? I mean, there's talk about a first link program that maybe you can, elaborate on. But like, how could you help me? So I'm whether the daughter or I'm a spouse of a person who just receives this news. Take me through the process.
Sure. So at any point, people can call us for help. So whether it's just the diagnosis just been received or it's been years, people can call us at any time. So the first step is at our intake and orientation, so that people will talk to one of our counselors and assess the need. So whether it's a person with a neurocognitive disorder or a caregiver, it's the same thing. We go through a needs assessment. One of the services that we have is individual psychosocial support. So this is really important because caregivers and people living with dementia can really have a secure and confidential space really to discuss their reality. So this is one of our basic services that I think is really helpful because it's one-on-one psychosocial support. After that, this person can meet with a counselor that is really specific to their reality. So we have counselor for people living with dementia, and we have counselors for caregivers. That said, when the needs are assessed, then we need to put in place some services. It's either in our organization, but also refer to other services in the community. So with our partners, we really like to have good partnerships with other organizations. Depending on where the people are in their journey, we can also offer some respite and stimulation services. So we have in-home respite and stimulation services. We also have the services in activity centers. So those are two types of respite and stimulation that we can offer. So this is an interesting program because we offer, yes, respite for the caregivers, which gives them time and space to really do whatever they want. When we are with the person living with neurocognitive disorder, but we also offer specialized stimulation for that person. So it's not just being present, but also stimulating with interest and significant activities. We also have our therapy for people living with neurocognitive disorder and for caregivers. We have some support groups for both of them. We also have therapeutic activities such as laughter yoga, as Jeane mentioned previously. So really the first step is our intake and orientation. And depending on where the person is at, what their needs are, then we offer different options in our organization, but as well as in the community.
So in terms of that first process, I mean, I really love your person patient centered approach. So do people have to come in person to meet with a counselor, or are you now offering like some Zoom consults or phone consults? I mean, how does that work?
So the key word, I think, is adaptation. For some people, it's better to get out of the home and meet someone else outside. So they're outside of their context of caring and supporting. For some of them, it's a phone call. It can last an hour or just a 30-minute phone call. It can also be a Zoom session. So I would say we really do what's the best for the person and the best way that we can offer help for them. So either in person, telephone, or a Zoom call or a team call or something, Skype sometimes. So it really depends on what the person is comfortable with.
Okay. And as you mentioned earlier, I mean, Montreal is a very culturally diverse city. So, besides English and French, do any of your counselors speak other languages so that you can accommodate this cultural community?
Absolutely. So we have a counselor that is fluent Italian, and we also have a counselor that is speaking Arabic. But we also have some partnerships with people that can help us translate when there's a need for that. So I would say that that's the way we address those types of issues.
Okay, so that's what you meant by when you're saying you have collaborations with other community organizations,
Absolutely.
so culturally diverse community organizations where you partner with. Okay, because that I
Yes,
find
absolutely.
very, very important.
And
Okay,
it's important to know some organizations that work well and are known in different communities, because they become are linked with different cultural communities. It's really important for us and for the people that we're helping also.
so let's talk about caregivers now, or care partners. I mean, how do the needs of spouses or partners of people living with dementia differ than the needs of children? And when I talk children, I'm talking like I was a sandwich generation care partner, differ. And so how would you support the different types of care partners?
Mm-hmm. So, well, you mentioned the word sandwich. So, one of the big difference is that for children caring for a parent, there are thorn between maybe their professional life, their life with their own children, and helping their parents. For the spouses, one of the things that we see is that living with 24 hours a day, 7 days a week with a person that has a neurocognitive disorder can be really intense. So there are different ways, but there are ways also that are similar. What I would like to say is that ambiguous loss, I don't know if you've heard about that, Claire, probably.
Yes, or anticipatory mourning, right? We call it ambiguous loss or anticipatory grieving. Yeah.
So this is something that can be seen in all the different relationship, is that where you are grieving someone that is still physically there. So this is something that either you're helping a parent or a spouse. This is something that we see every way, and the best way to address the differing needs is to assess them individually. So this is really the basics. So someone that is caring for a parent or a spouse, there, even if it's the same thing, the reality is different. So even if I'm caring for a parent and I have a friend who is also caring for a parent, this wouldn't mean that we're living the same challenges, or that we know the same thing about the disease. So I would say the first step, and really the most important one, is assessing the individual need, whether you're a child caring for a parent or a spouse caring for a loved one.
Okay. So I want to go back a little bit about the respite program that you offer. Can you explain that a bit more? Is it like a few hours where you will have one of you members of your staff come in and relieve the care partner? And if so, how does it work? How can people access that respite program?
Okay, so the first step is always the same, is our intake and orientation counselor. I would say, well, yes, we observe a need for respite, but also a need for stimulation for the person living with a neurocognitive disorder. There are two ways that we offer these services. It's either in home. So yes, we have a specialist that comes in home for 2 to 4 hours a week and really help the caregiver by giving them respite, but also having significant activities with the person that they're accompanying. There is also a respite and stimulation in activity centers, which is different. It's a whole day that the person living with Alzheimer's or another neurocognitive disorder comes in our activity centers for the day, for let's say 5 hours. They eat lunch with us, they make activities, exercises in the morning and in the afternoon also. So this gives the whole day, or most of the day, to the caregiver that can do whatever they feel like doing. But and the person comes to our activity center, which is interesting because it's not individual services, but it also brings social interaction, which is really interesting for people that we see in our services. They appreciate that, having this social interaction, going somewhere else than receiving services at home or in a hospital or a clinic. So it's outside of the caring system or the healthcare system, I would say, but it's really adapted to their reality and capacities.
Okay. Thank you. That's very, very. It's amazing how you have such significantly important programs for care partners. So let's talk a little bit about preventing cognitive decline. I mean, do you offer any courses, workshops, information for individuals, like everyday, the general public at large, in terms of how to prevent cognitive decline?
Yes. I would talk about my cognitive health. Maybe Jeane, if you want to jump in with early diagnosis, our awareness program with my cognitive health. I think this could be it's something that really is interesting for Jeane. So I would like, I think she'd like to talk about it.
Absolutely, very important. The diagnostic precoce for me is one of the big issue that we need to put our energy in communicating the importance of having the early diagnostic, and the prevention is also an angle that we really want to work on it, and to promote also all kind of activity where people can get some ownership on different abilities or different activities or different behavior that they can change and act on it. So the cognitive health program is working on sleep habit, healthy habits, all the food also intake that we have, mistakes. OK, comment je dirais ça, l'alimentation en anglais?
The nutritional benefits?
Yeah, okay, yeah. So it's to bring all the nutritional benefit, also the importance of choosing the good food and everything in terms of prevention of the cognitive decline. So we have created 5 videos on different topics that we're presenting into different organizations, mainly in the Northern Montreal. We have like a nice overview of those capsules in Montreal. So that's something that we want to promote all around Montreal also. Now our content is more of people that are diagnosed with the disease, but we also want to promote any activities, prevention activities to grand public also.
Okay, so a very important question now. My last question is, how do people access all this information? How can we access this new guide that you've developed? What's available on your website with regards to resources?
Yeah, there's a lot that are available on our website. You can go at www.alzheimermontreal.ca, and you can go into programs. You could see a lot of information about our programs. You can also go on different questions that you have, people living with the dementia, the caregiver. So there's a lot of information directly on our website. Or you can also call in, and we'll be referring you to the people that can help you. Either it's intake and orientation, or either it's the individual assessment of your needs. So feel free to go on our website, to call us, and you can get all the information, and we'll be pleased to help you.
Can I please have the number where people should call?
Yes. It's 514-369-0800.
And on the McGill Dementia Education website, we have a section called Resources, and we have a direct link to your organization on our website. And any last, final notes with regards to any events coming up, anything that you would like to share with our viewers?
Of course, we have our colloquium that's coming on January 25th. So it's going to be a nice colloquium all day with a lot of experts, and we're looking for the best practice all around the world and here. So it's going to be some nice sharing, and we're going to present all kind of topics also. So welcome everybody to join us on January 25.
And how do people sign up and register for that full day workshop?
Yes, because we're going to have a page on our website for the colloquium, so you'll be more than pleased to go and register.
Well, thank you very much to you both for taking the time today to share all of the important services and programs that Alzheimer Society of Montreal offers.
Thanks for the opportunity, Claire. Thank you.
Yes, thank you so much.
So this webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I would like to sincerely thank the Zeller Family Foundation for sponsoring today's webcast. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you would like to join our mailing list to be notified of upcoming episodes of McGill Cares, as well as hear about important programs and resources from us, you can sign up at mcgill.ca/dementia or send us an email at dementia@mcgill.ca. Thank you for watching.